Have you been feeling more tired than usual lately, even after a full night's sleep? Many people ignore this thinking it's just age or stress. But according to the World Health Organization, over 400 million people live with diabetes, and most don't know it yet. Type 2 diabetes doesn't always start with obvious warning signs. In fact, the earliest symptoms are often so silent, people live with them for years without knowing. That delay can lead to serious complications like kidney damage, nerve pain, or even vision loss. The good news is, spotting these early signs can help you take control quickly. In this video, you'll discover 5 silent symptoms of type 2 diabetes that you must never ignore. One of them is so subtle, even doctors say most patients overlook it. Stay with me until the end. You might recognize one of these signs in yourself today. Comment below. When was your last time blood sugar check? Do you remember? You might think it's just a part of getting older. But if you constantly feel exhausted, even after resting well, something deeper could be going on. Fatigue that doesn't go away is one of the earliest and most ignored signs of type 2 diabetes. It doesn't feel like normal tiredness. It feels like your body's running on empty, even after sleep. You wake up feeling just as tired as when you went to bed the night before. That's because your cells aren't able to use glucose properly for energy. When sugar builds up in your blood instead of fueling your body, energy levels crash. Your muscles starve, your brain slows down, and every task starts to feel more difficult. Even simple things like walking, climbing stairs, or cooking can feel heavier and more draining than usual. This type of tiredness can be physical, mental, or emotional, and often all three at once. You might find yourself struggling to focus, feeling low in mood, or snapping more easily than usual. Many people brush it off as stress, aging, or not getting enough sleep. But when fatigue lingers for weeks without explanation, it's time to look deeper. One study published in Diabetes Care showed that fatigue is a common early complaint in undiagnosed diabetic patients. And yet, because there's no fever or pain, people often ignore it until more serious complications appear. You should especially pay attention if this tiredness comes along with other small symptoms like thirst or blurry vision. The combination could mean your blood sugar has been high for a long time without being treated. Ignoring this warning sign can delay diagnosis and increase your risk of long-term damage. But if caught early, fatigue can improve significantly once your blood sugar is managed properly. The sooner you act, the better your chances of avoiding serious damage to your nerves, kidneys, and heart. Always listen to your body. Fatigue is not just laziness or low motivation. It's your body's cry for help when energy production isn't working the way it should. If you've been feeling unusually tired for weeks, it's wise to speak to a doctor and check your blood sugar. Managing your diabetes early could restore your energy, your mood, and your ability to enjoy daily life again. Comment below. Have you experienced this kind of fatigue in your life nowadays? You might think drinking more water lately is a good habit or just a response to warm weather. But if you constantly feel thirsty, even after drinking water, it could be something more serious. One of the most common and silent symptoms of type 2 diabetes is excessive thirst, also known as polydipsia. It's not the kind of thirst that goes away with 1 or 2 glasses of water. It's the kind that keeps coming back, no matter how much you drink. You may find yourself waking up at night just to drink water. Your mouth might feel dry all the time, and swallowing may seem uncomfortable. This happens because when your blood sugar is too high, your body tries to flush it out through urine. As you lose more fluids through frequent urination, you become dehydrated, and that triggers intense thirst. Your body is actually begging you to replace what it's losing so quickly. Even if you're drinking enough water, the thirst keeps coming back because the sugar problem remains. Many people confuse this symptom with dry weather, salt intake, or medication side effects. But if it continues for more than a few days, and you also urinate more often than usual, take it seriously. According to a study in the Journal of Clinical Endocrinology and Metabolism, polydipsia is among the earliest reported symptoms in undiagnosed diabetes cases. And sadly, it's one of the easiest signs to overlook because it feels harmless at first. But ignoring the symptom allows high blood sugar to continue damaging your kidneys, nerves, and blood vessels. You may not feel that damage right away, but over time, it can lead to long-term complications. One important thing to observe is how often you feel thirsty after meals or sugary drinks. If thirst increases after eating, it may be a clue that your sugar levels are not being regulated. Also, pay attention if your lips, tongue, or throat feel sticky or unusually dry throughout the day. This can be your body's early warning before more serious symptoms start appearing. The sooner you catch this pattern, the easier it is to get your blood sugar under control. Managing diabetes early helps your energy, digestion, sleep, and overall health improve dramatically. So if your thirst has become excessive or constant, don't ignore it. It could be your body's silent cry for help. Comment below. Do you often wake up at night feeling thirsty? Point to be noted. Going to the bathroom a few extra times during the day might not seem unusual at first, but if you notice it's happening more often, especially at night, it could be a silent sign of type 2 diabetes. This symptom is called polyuria, and it's one of the earliest ways your body tries to manage high blood sugar. When blood sugar levels rise too high, your kidneys struggle to keep up. To remove the extra sugar, they start pulling water from your body and sending it out through urine. As a result, you may find yourself needing to urinate every hour or even more frequently. Many people wake up multiple times during the night just to use the bathroom. It may interrupt your sleep and leave you feeling drained in the morning. And because your body loses water so quickly, it increases your risk of dehydration as well. You might notice your mouth feels dry, your skin feels tight, or your eyes seem irritated. Frequent urination can start subtly, once or twice more than usual, but then gradually become more noticeable. People often assume it's due to drinking more water or getting older, but if it's happening day after day, you should not ignore it. One study published in the American Journal of Medicine noted that increased nighttime urination was a common early complaint in patients later diagnosed with diabetes. In fact, many people discover their condition only after their sleep becomes severely disturbed by repeated bathroom trips. This isn't just inconvenient. It's a sign that your blood sugar has been high for a long time. If left untreated, the kidneys may become damaged from the constant overwork. Other complications like high blood pressure or urinary infections can also develop over time. You should also notice if the urine is lighter or more diluted than usual. That can happen when your body is pushing large amounts of fluid out quickly. Also, take note if you feel a sudden, urgent need to go without much warning. If these patterns sound familiar, they're worth discussing with your doctor as soon as possible. Getting tested can confirm whether high sugar is causing your symptoms, and early action can help reverse them. Don't let this quiet signal go unnoticed. Your body is trying to alert you in the only way it knows how. Comment below. How many times do you wake up at night for urination? Your eyesight is something you rely on every single day, often without even thinking about it. So when things suddenly look blurry or out of focus, it can be confusing and alarming. Many people assume it's just due to aging, tiredness, or needing new glasses. But blurred vision is actually one of the most common early symptoms of type 2 diabetes. This happens when high blood sugar causes fluid to shift into and out of the lens of your eye. The shape of the lens changes temporarily, which affects how clearly you see things. You might notice you're squinting more, struggling to read, or your distance vision has changed. Sometimes the blurriness comes and goes, depending on what you've eaten or how high your sugar levels are. It might happen in both eyes or just one, and it may improve slightly after rest. But if it keeps happening, even off and on, it's something you should not ignore. According to the American Diabetes Association, uncontrolled blood sugar is a leading cause of vision problems in adults over 40. Left unchecked, it can lead to diabetic retinopathy, which causes permanent eye damage and even blindness. Blurred vision in diabetes doesn't always come with pain or redness, so people often wait too long to get help. Some even change their glasses prescription multiple times without realizing the real issue is unstable blood sugar. You should also take note if your eyes feel dry, heavy, or overly sensitive to light. Those small signs can appear weeks or months before major complications develop. It's important to understand that this vision problem is not limited to long-term diabetes patients. Blurred vision can be one of the first signs, even before diagnosis, especially when combined with fatigue or increased thirst. One moment everything looks sharp, and the next it feels like you're looking through a foggy window. If this keeps happening, your eyes are likely responding to changes in your blood sugar levels. The good news is that when diabetes is caught early and managed well, these vision changes can often be reversed. But the longer you delay, the more permanent the damage may become. Never ignore your body's signals. Your eyes might be showing you a hidden problem inside. Get your eyes and blood sugar checked if blurred vision is becoming more frequent or frustrating. Comment below, have you ever experienced at any time or anywhere sudden blurry vision while sitting or moving? Have you ever felt a strange tingling in your feet or a numb sensation in your fingers that just wouldn't go away? It might feel like pins and needles or like your hands and feet have fallen asleep. Most people assume it's from sitting too long or bad posture, but sometimes it's something more serious. Tingling or numbness in the hands and feet is a very common silent symptom of type 2 diabetes. This happens when high blood sugar starts to damage the small nerves, especially in the outer parts of your body. The condition is called diabetic neuropathy, and it can begin years before a person even knows they have diabetes. It usually starts slowly and feels mild, just a little numbness, tingling, or a strange buzzing feeling in the toes or fingertips. But over time, this nerve damage can become painful, permanent, and even disabling if left untreated. You might start to notice sensitivity to touch or burning sensations at night, especially in your feet. Some people describe it as walking on gravel or having sand stuck in their shoes all the time. This can affect your balance, your walking ability, and even your sleep. Unfortunately, many people ignore these symptoms or assume they're just part of getting older. According to research published in Diabetes and Metabolism Journal, over 50% of people with type 2 diabetes experience some form of neuropathy, but in most cases, they don't report it until the damage is already advanced. If caught early, this type of nerve damage can be slowed down and sometimes even partially reversed with proper blood sugar control. So if you're noticing unusual sensations in your feet or fingers, don't wait for it to get worse. Watch for patterns like tingling that gets stronger at night, numbness after walking, or a loss of feeling in certain areas. Also, be cautious if you accidentally injure your foot and don't feel much pain. That's a red flag. Unnoticed injuries can lead to infections or ulcers in diabetic patients with nerve damage. It's essential to check your feet regularly and talk to a doctor if you notice anything unusual. Your nerves are like warning wires in your body. When they go silent, something deeper could be wrong. The earlier you act, the better your chances of protecting your health and independence. Comment below, have you ever experienced strange tingling or numbness in your hands or feet? You've now learned 5 of the most silent and easily ignored symptoms of type 2 diabetes. Fatigue, excessive thirst, frequent urination, blurry vision, and nerve tingling are not just harmless issues. They are quiet warnings from your body that your blood sugar might be out of control. These symptoms often appear long before a person is officially diagnosed with diabetes. That's why so many people go months or even years without realizing what's truly happening inside their body. But here's the hopeful part. Catching these signs early can help prevent long-term complications. You don't have to wait for diabetes to cause serious damage to your nerves, eyes, kidneys, or heart. With a few simple tests and early lifestyle changes, you can take control before it's too late. Never feel ashamed or scared to speak to a doctor about what you're experiencing. It's better to be safe now than sorry later. The earlier you act, the easier it is to manage and sometimes even reverse many symptoms of type 2 diabetes. Your health is in your hands and awareness is the first step toward healing. So stay alert, stay informed, and always listen to what your body is trying to tell you. Comment below, which of these symptoms surprised you the most, or have you experienced any of them lately? And if you found this video helpful, don't forget to like, subscribe, and share it with someone who needs this information today.